Laparoscopic surgery, also known as minimally invasive surgery, is a modern surgical technique that uses small incisions and specialized instruments to perform procedures inside the body. It offers several advantages over traditional open surgery, which involves larger incisions and direct visualization of the surgical site. Here are the basics of laparoscopic surgery and its advantages. Basics of laparoscopic surgery. Small incisions. Laparoscopic surgery involves making a few small incisions, typically 0.5 to 1.5 centimeters in the abdominal wall. These incisions are known as ports. Trocar placement. Trocars are specialized instruments used to create access points for the surgical instruments. They are inserted through the incisions. Gas insufflation. Carbon dioxide gas is introduced into the abdominal cavity to create a working space and improve visibility. This lifts the abdominal wall away from the internal organs. Camera and instruments. A laparoscope, a thin tube with a light source and camera, is inserted through one of the ports. It provides a magnified view of the surgical area on a monitor. Surgical instruments are inserted through other ports to perform the procedure. Surgical technique. The surgeon uses the camera feed to guide the instruments and perform the procedure, such as tissue manipulation, cutting, suturing, and cauterization. Closure. After completing the procedure, the instruments are removed, and the small incisions are typically closed with sutures or adhesive strips. Advantages of laparoscopic surgery over traditional open procedures. Smaller incisions. Laparoscopic surgery requires smaller incisions, which result in less tissue trauma, reduced scarring, and decreased post-operative pain. Faster recovery. Patients undergoing laparoscopic surgery often experience shorter hospital stays and faster recovery times compared to open surgery. Reduced blood loss. The minimally invasive approach usually leads to less blood loss during the procedure. Lower infection risk. Smaller incisions and reduced tissue exposure contribute to a lower risk of surgical site infections. Less pain. Patients typically experience less post-operative pain due to the smaller incisions and reduced tissue trauma. Improved cosmesis. The smaller scars resulting from laparoscopic surgery are more cosmetically appealing compared to the larger scars from open surgery. Quicker return to normal activities. Patients can often resume their regular activities sooner after laparoscopic surgery compared to open surgery. Lower risk of hernias. The risk of incisional hernias occurring at the surgical site, is reduced due to the smaller incisions. Better visualization. Laparoscopic cameras provide magnified, high-definition views of the surgical area, allowing for precise and detailed work. Minimal internal scarring. Laparoscopic surgery minimizes internal scarring, which can be a concern with open surgery and may lead to complications in the long term. It's important to note that while laparoscopic surgery offers numerous benefits, not all procedures are suitable for this approach. The choice between laparoscopic and open surgery depends on factors such as the patient's medical condition, the complexity of the procedure, and the surgeon's expertise. Always consult a healthcare professional for personalized medical advice.